Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.
Good morning and welcome to another episode of Hashtag Ask the Experts, brought to you by the Namibia Media Trust and the DW Academy. Now, this platform serves as an opportunity for journalists to ask the experts questions relating to COVID-19 directly. Now, COVID-19 has probably been one of the most horrendous global surprises to happen to humankind. It has tested, questioned, and collapsed health infrastructures around the world, and it showed us our shortcomings in the provision of healthcare, and not a single country or nation has been spared. At the front line of all this chaos, putting their own lives at risk, was the bravest of men and women that we know. These are frontline healthcare workers, doctors, nurses, midwives, anesthetists, surgeons. The list is endless, and today we acknowledge them. Today, the 1st of December, is also World AIDS Day, and we spare thought in remembrance to all of those who have lived and are living with the virus, especially during a time such as COVID-19. Now, experts joining us today are Dr. Pino Aldanal, a medical doctor at the Robert Mugabe Clinic. Dr. Pino, thank you so much for joining us. Good morning and welcome. And with him, he'll be joined by Ms. Hannelie Botha, who is the General Manager at Lady Pohamba Private Hospital. Hannelie, thank you so much for joining us this morning. Thank you. We've also got our sign language interpreter, Salma Moses, joining us this morning to include all individuals and all our viewers and listeners this morning for Hashtag Ask the Experts. So good morning to everybody and welcome. I'm your moderator, Nina Katangana. We refer to our frontline healthcare workers as modern day heroes. Do this, the staff, the nurses and doctors of Lady Pohamba Hospital resonate with this title? Do they feel heroic in such a tremulous time such as this?
Yes, thank you for the privilege to participate in this discussion. I agree with you. It's they are heroes, and I agree that we experience that the public and the people around us really honored them as heroes. There's no doubt about it, yes, and we feel heroes because we could participate in helping people to save lives, because that's why we're here. And that's part of our genes. And so, yes, we experience that we are heroes because the public and the people around in the world, they are really supporting.
I'd like to know, obviously, COVID-19 took us all by surprise, and I don't know how long you've been at the Lady Pohamba Private Hospital, but talk to us about your operations and how they differed from, pre-COVID to post-COVID, or currently within COVID. So through 2020 to 2021, what were your operations like, and what changed?
Yes, it really changed a lot. Number one, there's no textbook answer for it because there's no experience in the world. So you have to think on your feet. Number one, according what you see in the media or what you read the other countries went through, and then you try to get solutions. And some of the solutions or the compensation is changing minute by minute. Some of them are still existing, but you have to be with your feet on the ground and your ears also on the ground. So what changed? Yes, obviously, the entrance changed. You have to limit the amount of visitors in the hospital, and that was very, very tough for the patients as well as the staff, because a visitor or a next of kin person that is needed next to the bed. It's part of healing, and we couldn't maintain it. And that puts extra stress on the patient as well as on the staff, and yes, on the families, because they want to support. So that changed operationally. It was never, in my career, it was never like this before. You have to be in the middle, and the messenger, switch on the cell phones, help the patients to communicate with their beloved ones. And then the staff, obviously, you have to make it easy for them and protect them with PPE wear, enough PPE wear. They have to feel safe. So, and through the whole day and night, you must make sure the managers on the floor, are you fine? How do you feel? That support to them. That was one of the psychological part. Obviously changed. You have to build in some psychological support to the staff and to the patients. Operational, also stuff like providing food. You have to think different. The people can't just walk in. You have to make new plans, and we learned a lot, and we're still learning. But looking back to it, yes, there was a lot of changes to keep it safe, to make them feel you are safe, the patients. And
But Hannelie, you mentioned something interesting, which was, in terms of operations, even, the food that you give your patients, something that is seemingly so small but important to the diet of somebody who is, infected with COVID-19. So I want to know with that, what your costs look like. Was that a challenge also over the past year and a half, 2 years? Have you had increased expenses as a hospital due to the impacts of COVID-19?
oh yes, for sure. Number one, we had to prepare the facility as an isolation ward. We installed a negative pressure system in that specific ward that helps to lower the viral load for the staff. And if we allow visitors, then it is also more safe for them if they're coming in. So that was an extra expense. On the food, yes, it's simple things, but you have to look at it. The dietitians had to come in, and I also had COVID, so I knew that your appetite is low, but you have to eat. You have to get nutrition. Your nutrition status must be maintained. So we had to think out of the box, protein shakes to the patients because they don't want to eat, and we offered nice, like, fruit protein shakes to the patients. At least we knew that's replacing a meal for them. Yes, extra expenses like PPE wear, we had to prepare for that. The medication initially, yes, it was tough to get all the medication here in the country. I think all the other healthcare facilities will agree, and a lot of effort that go into that, but and that was extra costs, extra motivation to the medical aides to give authorization, which they did, but that was the extra mile, which is a privilege for us, but yeah.
And what was your staff turnover like? Because also with the pandemic, you want to have as many hands as possible on deck, but you also don't want to expose your entire staff complement. Should anybody fall ill and you have no nurses and doctors to be on call to assist these patients, that is a crisis in itself. How did you manage that?
Yeah. During the first wave, 63 of my staff members became sick. And I remember quite clearly, I was so scared, but you can't indicate it to anyone. And we tried to reshuffle the staff between the high-risk areas and the normal areas. And then you have to remove as well the staff with high comorbidities as well. The pregnant ladies can't work in the high-risk areas, or the people with comorbidities. You try to protect them. So yes, we managed it, but you have to do extra plans to make sure, and it's good. We learned a lot. My growth curve increased by, I think, straight up. And the second wave, the total of staff that became sick was 83. There's another 20 that became sick during the second and the third wave. But two of them were hospitalized, but recovered well, and we are really grateful for it. So yes, that was extra stressors for the staff.
Dr. Pino, welcome back. Can you hear me?
Yeah. Yes, I can hear you. Do you hear me now?
Oh, fantastic. I can hear you clearly. Just to start with, Dr. Pino, I was saying that, we consider our frontline healthcare workers as modern day heroes. Do yourself and your colleagues at Robert Mugabe resonate with this title? Do you resonate with this title? And if so, why?
Yes, first let me say we are a team spirit work is the first things. We push us to start working with COVID patients because really it was a very worse health situation. I remember when starting in Namibia around early 2020, around February, starting of course that at that time is not really considered as a pandemic, but by March, April, starting the pandemic, then we here in Namibia starting organizing which centers we are going to take for testing patients, because we see in the world spread all over, and patients really become very sick and no vaccine available at that time. So we decided open Robert Mugabe around 14th of March, but it was a collaboration for the coordination, administration, logistic, case management, IPC or infection prevention control. I consider all of them are also heroes, because as some say, it's a teamwork, and when we are starting, we have not even experienced how this is going to behave that way. At the end of the day, we just fighting against the virus to saving life. And it's like when you are in the war, you are going to fight, the enemies, but this is an invisible enemy. So you don't know really which is your enemy, because you can see. They only see you is you wearing your mask, take you all the protection. That is the reason it's very hard to see people even die and you don't know why or who is killing the people, because you can see. And it's very painful for all the people who lost their loved one. And then for us, every day, of course, we manage to training ourselves, to train more people, to recruit more health workers, even people from not Ministry of Health also come to help us. We appreciate much the private sectors also involving and enjoying us. I also consider them as a hero, and really we are very proud for the work that all of us are done in Namibia, because now I can say we have around 97.2 recovery cases. So it's very high rate for recovery cases in Namibia, and that is really very comfort for us, and we are very proud for the work that all of us are done.
Talk to us, Dr. Pino, about how the operations of Robert Mugabe Clinic, has changed over the last 2 years.
Yes, Robert Mugabe Clinic is a clinic, most likely is HIV clinic. When the service that offered. Of course, they offer another service like attending pregnant women, pediatric patients. But when this pandemic come, we realized that we have to open a center that we can assist those kind of patients. Then we remove all the devices, all the staff from Robert Mugabe, and putting another facility to start over afresh to convert that center, that facility in the tester center. At the beginning, Robert Mugabe, apart from that, the tester center also, we disclose a result of the patient. You can see one queue for patient coming for testing, another queue for patient for receiving the result. Then it's overcrowded, that place really. I was hectic. So we realized we have to open more centers that then we are starting giving result apart, because most of those patients, maybe they are negative or they are already recovered. So we can mix all the patients together, and then we just realize that if the patient is already recovered, can be reinfected, or if the patient is negative, the patient can get the COVID as well. So that is very, very, I say, very hard work to move all the staff, even during the pandemic. I remember the first wave was not that hard as the second and the third wave. But the situation was that we realized that Robert Mugabe alone can manage the pandemic in Namibia. Then what we did is to train people and then open another centers all around the country, not only here in the Comas region. That is when also a private hospital was involved, lab was involved, because NIP also was not enough for getting in 72 hours the result. So that is the reason we involved also a pillar lab that combine all different lab, and then like that we overcome the situation. And Robert Mugabe really still, because another thing is we all not only testing patients for COVID, we also testing patients, for example, for malaria, for influenza, for dengue fever, because sometimes the patient come with fever or any other symptoms, but we need to discard that is not malaria or dengue or any other health condition that can cause similar symptoms. But Robert Mugabe really, sometimes even NBC was there one day and see the situation and say, no, really, you are fighting very hard. You really love people from Namibia, because really I appreciating also the people who been there and also give us support, even psychological support, logistic support, because they also contributing to us to finish that pandemic here in Namibia. I say finish, but we are not finished yet, because more variants coming on the way. But for now, this fighting, I think we are gaining.
Yes.
Okay.
I want to talk about the challenges that you face, not only as a facility, but also the challenges that the frontline healthcare workers face. Hannelie, perhaps you can start with us with that.
Okay.
With that question. Not only the challenges that was faced by Lady, Pohamba, but also, the staff complement. We spoke about, the psychological toll, obviously, that this virus takes on healthcare workers as well. I think probably more especially than anybody else, because they see every day, how this virus is ravaging through the communities. So yes, talk to us about these challenges that you faced, Hannelie.
Yes, as I said, you have to protect your staff the whole time and make sure they're safe. So how you allocate them every day, it's not that they're allocated when they're appointed to, say, for instance, the maternity department. And what about the isolation unit? They're also exposed in the, say for instance, in the maternity department. Then you're thinking about your staff who's working there. Okay, they also have comorbidities. Remove the midwife with comorbidities to another department that is not exposing for her or him. So you have to reshuffle the whole day, not only once a day, but sometimes 3-4 times a day, to make sure that they are safe. That's on the staff. And then, you know, they are supposed to be here. But I could see sometimes they scared through their eyes, and then you want to make it lighter for them, but you can't. You just have to be there for them. And to what we did is, as you said, except for the psychological support, which is still needed, it is still needed, but also to look after the health. So we try to provide balanced meals to them. Their vitamin system is also so important, and extra vitamins. So because they are the people that you have to depend on, you know, and that is why the more every day I felt protection for them and support and security of them will help us will help them to help the patients. And you have to make sure that they have enough medication, because if they're starting to feel that they can't help the patients, then they will also lose control. So that was one of our biggest challenges that we faced.
Dr. Pino, were your challenges the same as what Hannelie just spoke about? You mentioned also the continuous training of your staff so that you could stay on top of you know, this COVID-19 virus and understand it better, because then you're able to administer help better to the patients. So are you, Dr. Pino, were your challenges the same as what Hannelie just highlighted?
Yeah, I think almost all the facilities, even private as state facilities, facing the same challenge. Of course, as she said, we have to relocate it and just break the rotation, because some of our staff have a comorbidity like a diabetic, hypertension, or asthma, or any other chronic condition. So those staff we can put at risk, or at least in the area of high risk to get COVID, because we know when the person or the patient or individual have those such comorbidities, is a high risk, and also to develop severe disease or hospitalization. So meaning we have to remove those staff and put the staff that were not have those conditions. And it was a challenge because we have to, as I said, reroute the rotation. Of course, we didn't close the essential service to continue, but we have to remove some staff. Even some person we give leave to go home because they are not fit for be working with COVID patients. Another challenge that we also facing was the oxygen supply. That was very, very, very concerned for us, the oxygen supplies. Since the oxygen coming from the distant source, we some of days the oxygen was even finished, and we just running to look oxygen whatever it was, because we are facing really, the oxygen was very, very concerned situation during that pandemic. Another challenge that we facing also was that we have to recruit staff, health worker staff, but most of them are juniors. So we facing that challenge that some juniors, persons that have not the skills and the ability to manage the patient, we put in that level, of course, but we are training them and putting in the right place to manage patient. But we know that we always supervise them how the work is done, especially in the infection and prevention control, because that is a principal pillar to cut the chain transmission from each individual. Also, another challenge that we're facing was the high infected staff members also. That was also a challenge that we're facing, because as you see, many, I have not say numbers, but because this is a private thing, but we have a lot of staff that get sick during the pandemic situation. So that is also one of the challenge. Also, another situation or another challenge that we are facing sometimes is the short, the lack of a stock of some medicine that we are using for a patient with COVID. Also, it was the situation, but we managed to get medication on time, but sometimes we are facing that situation that we are running out of some medicine for treating a COVID patient. And all of these challenges have the consequence that some patients get critical, get hospitalization, and some of them maybe die as well.
You mentioned also that the supply of oxygen was a big challenge for you at Robert Mugabe Clinic. And I think we all know that as the public. It was in the news all the time that there was a shortage of oxygen supply, which is critical to treating COVID-19 patients that have severe symptoms. What is the status quo now on your supply of oxygen? I know now the cases are much less, so less people need this. But as you mentioned at the start of our conversation, we've got a new variant that is, has just popped up, reared its head, and we don't know which way it's going to go with this variant, if it's going to cause another wave, etc. So what is the status quo concerning the supply of oxygen to Robert Mugabe?
Okay, now recently on the 18th and 19th of this month, we have a meeting where we gathering all the pillars. When I say all the pillars, I say coordination, case management, logistic, IPC, infection prevention and control, surveillance, all the administrative area to discuss this matter, because we know the fourth wave is going to come. So at Robert Mugabe, we develop a ward oxygen, meaning that all the isolation ward, all the patients in observation, in the screening room, we have oxygen available in case that we have a crowd of patients in just one day, or as we are expecting a fourth wave. Also, we discuss or recommend that we have to buy a generator, oxygen generator for the hospitals, and also mobile oxygen generators for the other facilities. This is under discussion, and I think it's going to be available because all of us in that meeting was agree that this situation with oxygen with the third wave was critical. And now I think we are ready, and we are planning for the fourth wave. I think we are ready, and we have all the resources for now for facing that fourth wave in case it is come.
When we spoke about the support that was given to the staff members of Robert Mugabe and at Lady Pohamba, Hannelie mentioned, of course, the psychological support is also very important. So what are you doing for the staff members of Robert Mugabe to make sure that they stay present, alert, that their emotional and psychological well-being is taken care of so that they're able to give their best to the patients that come through your doors?
Okay, thank you for that question. We have social workers in the clinic. We have psychologists, also doctor who assist all the staff member, and we develop meetings in the clinic relating to psychological support. And also we receive, for example, some donations for some other private companies that also encourage it's not only the materials that we receive, also encourage psychological why us as a staff member of Ministry of Health have to be ready or prepared for in case that fourth wave come in. And then also us as a doctor, also if any our staff is, or let's say depressed or any other situation, we also help emotionally and even economically for that staff get ready to and be prepared in case that we have to facing another wave. So also we do culture activities where you can relax. Now even we planning to do for the end of the year activity for all staff. So meaning we are moving, we are not quite just assisting patients, we also moving forward to see emotional sphere in all the staff. And if any problem come out, we just go to the staff and try to solve the problem as soon as possible.
That's fantastic to hear. I want to talk about, the takeaways from this pandemic. What are the lessons learned, Hannelie, perhaps both professionally as well as personally?
In my career as a manager, I learned a lot about resilience, and I think the staff as well, that although you're working through a pandemic, resilience is very important and you can develop it. I think that's the one. And the second one that I've learned, we always know in a textbook that a team play is important. But when you're confronted with a war like this, you're more dependent on people. You have to honor people. I think that is for me on an emotional intelligence sort of way, the lessons that we've learned. Team effort, very important. Dependency, very important. Resilience, so important. And then you never arrive till death. You learn every day. I'll not choose a pandemic, but if you have to go through it, then you have to be strong and open to learn and to grow.
Being in the health profession, being a doctor and a nurse especially, I would say similarly to being, in the teaching profession, over the years has somewhat, the general perception is that it's lost its value. People feel that people that are in these professions no longer have that heart to serve. It's just like your last option. I'll study teaching, or I'll become a nurse. And not because you really love serving, you love helping. Do you think that what we've gone through has put the respect back into the, certain health professions such as nursing and such as that, due to what we've gone through, and we've seen how, without the doctors and nurses showing up each and every day, there was just no way that we would make it through that. So do you think this has helped to put the respect back into the profession?
From my side, yes. There's a total difference in the service culture. of the hospital, because I experienced that these people, it changed, and in a positive way, to have passion, to have empathy with people, with each other, as well as with patients and their beloved ones, for sure. It's not negative for me. It's tough, but it's not negative.
Dr. Pino, what about yourself? When we look at the takeaways, what are some of the lessons that you've learned professionally and personally as well, where COVID-19 and this pandemic is concerned?
Okay, thanks for this question. What I learned as individual, that is, we have to show more love for patients, and also to care more for a patient as well. Then, because what I say that because really it was a situation, hard situation that I never be involved. And then see a person who was fine and become sick just in a day or 2 days, it's very hard, and you don't know sometimes what to do in this situation, because sometimes I would say we are shorting of some maybe medicine supply or oxygen, and then it was very hard in that. But I also learned that mass ability and how to innovating sometimes in some situation to save the life of the patient. Also, I appreciate much the teamwork, because all of us under stress, under pressure, but we manage to take that patient back from a very bad situation or very critical situation. And it is very comfort for us, and we are feeling very proud every time that we save one life. Especially is the older people, it is a child, because we have cases that a child was very sick, and is even pregnant woman, that it was very concerned for us to lose this type of patients. Also, as I'm saying, the teamwork, the spirit teamwork, I always say that because if not for the teamwork, we can't overcome this situation. And all involvement for, as I say, all the factors, all the person, even the politics, the propaganda, the media that say, please use your mask, keep the distance, don't gather in indoor without ventilation. All of those help us also to overcome this situation. And so I learned many things, even simple things that you can imagine can help in that situation. So we're learning a lot in that epidemic things.
We've seen how this virus has mutated, and there's new strains of the virus that has come about. How do you make sure that you stay, on top of this rapidly changing virus? Just a few days ago, we've now heard of Omicron. What do you know about the virus, and how are you ensuring that should this become an issue for Namibia, we haven't confirmed any cases yet, or that this new strain of COVID-19 is in fact in Namibia? It's not being confirmed yet, but how prepared are you should this be the case?
Okay, as I say, we are preparing for the fourth wave. Of course, we never knew that this Omicron variant is going to come even closer to us. Is here in South Africa. It's our neighbor. But we prepared, as I say, logistic, case management, coordination, because we are expecting. And if you see the wave, the first wave is around 3 months, then is maybe 3 months of gap, and then come out with the second wave. So in between the second wave and the third wave is just happened the same. So we are expecting by December, we are talking about December, January in Namibia, is going to come the fourth wave. So we are preparing, or we are prepared already. But this virus, this Omicron, this variant, is different and unusual to other, let's say, Alpha, Gamma, Beta, and Delta. What we notice in this virus is this virus have around 50 mutations in the spike protein. That is for you understanding me, because I just talk technical things. Spike proteins is the protein that is attached the virus to the cells. So meaning, for example, Delta variant have 6 mutations, but it's only 2 in the spike protein, meaning, and also over compete the other previous variants. It was more transmissible, more dangerous, and people die and was hospitalized due to that Delta variant. This variant of Omicron, as some say, has around 50 mutation. 32 are attached to a spike, as a spike protein. Then, what tell us, we can say that Omicron going to overcome that Delta, but it tells us if we are looking the mutation, it's going to be more transmissible. It's going to be, you want to have more immune escape. When I say immune escape, meaning that he can escape the antibodies in the body of the person. So meaning it's going to be more infected and more transmissible. But today we can say that that Omicron variant is more severe or more critical than Delta, because the cases that found in South Africa, they are present with mild symptoms. As I say, it's very early. Let's maybe wait for around 3 to 4 weeks to see how is the behavior of the virus. The certain thing is, and this is a wake call for the people who are not yet vaccinated. The most important thing is now the whole people get vaccinated, because I see the percentage of vaccinated people here in Namibia, and it's not so high. South Africa have around 40%, if I'm not mistaken, of people vaccinated. Here in Namibia is less than that. And the transmission is, I think in South Africa, by the end of this week, they are going to say around 10,000 people per day infected with Omicron. Meaning the only way for now that we have to get all the people vaccinated, keep the social distance, wearing the medical mask, no gathering in indoor places that there are no ventilation, avoid the crowded places, and also, as I say, most important is to get vaccinated. Because, for example, Johnson & Johnson vaccine and Pfizer provide around, for example, Johnson & Johnson provide around 50% of protection against Delta variant. Pfizer provide around 64 to 87% of protection against Delta variant. Of course, this Omicron variant have more mutation, but the protection going to be maybe around somewhere there 40 something or 50 something in these two type of vaccine. Meaning, the most important thing is get vaccinated, and also keep all the measures as I mentioned before. That is my message for the Namibian people that we are not get vaccinated. I know people sometimes have culture situation and some belief, but for our safety and to save for example, me as individual, if not to my family and to other friends, is to get vaccinated. That is very important, that the Namibian people know about this new variant of Omicron.
Yeah. Hannelie, in terms of preparation for a possible fourth wave, how prepared is the Lady Pohamba Hospital?
Yes, on the oxygen part that the doctor mentioned, yes, it is a challenge, but what we have another bulk tank of oxygen on the premises. So it brings us to a total of 8 to 10 ton oxygen. It always depends on the supplier, because your usage increases a lot. So, but we are in that way, we are prepared. We have more ventilators. We have purchased more ventilators. And the medication at the moment, there's not a problem with it. It is there. We have enough. So yes, as the doctor said, we're looking to the next 2-3 weeks and look at the behavior of the virus. It is a challenge, and we also canceled some of the nurses' leave for December already to be available for patients.
Well, Dr. Pino gave some words of encouragement there to Namibians concerning the vaccine, and I think there's still a lot more education that needs to go into that for them to understand the importance of getting vaccinated. And we hear Dr. Pino describing the characteristics of the Omicron variant with these 50 mutations, so it makes it much more dangerous or more potent than the Delta or any other variant we've dealt with. And then he also mentioned how the immune escape possibility is a bit higher. So this variant could possibly bypass all of that. And so then you ask yourself the question, then what's the point of taking a vaccine if there's a possibility, if a variant that is this potent can bypass all of that? But what is your words of encouragement and to Namibians this morning?
I agree with the doctor. On a scientific way, we have to get vaccinated. That is at the moment the solution for us. At the hospital, we also have the responsibility to create a safe environment for our patients that's vulnerable, that's coming into for any other surgery. So yes, we have sort of herd immunity already from healthcare workers' side at the hospital, and we want to encourage the nation as well. Please get vaccinated, because we don't know the future of this virus and the behavior of the virus.
I see Dr. Bernard Halfiku has also joined us. Doctor, thank you for joining us this morning. We're talking about our heroes, which includes you as a medical doctor as well. And I'd just like to ask you a question as well, Doctor, seeing that you're on the platform concerning this Omicron variant of COVID-19 that has just come about. What do you know about the Omicron variant, Doctor?
No, thank you very much, Nina. I'm in the midst of things. As we know, today is World AIDS Day, and we're juggling from one topic to the next one. Well, it's very unfortunate when you look at the hyper in the media, in the public life. It's actually a scary thing when you look at it. The fact of the matter is that, and one can check this clearly with WHO, that this virus, this new mutant or new strain of coronavirus or SARS-CoV-2, it's a brand new thing that happened genetically to the virus, and nobody knows precisely its characteristic, its behavior and clinical or virology. Scientists are tirelessly working on it to get more information, and there's a statement released by WHO to this effect that we don't know much yet. Even the transmissibility that a lot of people are touting in the public, it hasn't been documented yet. I just want to mention one thing, that when a microbe, whether it's a virus or a bacterium, is mutating so much, it actually means that it's under immense pressure genetically. It's trying to dive and looking for survival. It's not just a matter of that the horrible apocalypse is now heading upon us. It is still a virus that we know that we can prevent transmission with a simple face mask that is well fitted, that your hands are sanitized or washed several times, that we don't go into crowd and do not do anything that is untoward, and that we take a vaccine as a mitigation factor. As simple as that. I think, the world has gone into hyper on something that shouldn't really be the case. I was shocked that Europe banned Southern Africa from traveling. I mean, honestly speaking, who is advising the political decision makers in Europe and the UK to make such a horrendous decision that has got no scientific basis? So WHO, and I will advise people to subscribe to WHO update, because the strategic advisory group on virology work every day to get the latest update from all over the world and tell us what is happening. I think that's just what we need to know while we're still keeping the basic, very simple public health measures in place. Now, the last word I wanted to say is to the colleagues there from Namibia. I see Ms. Nelbe and other people. Get together now as healthcare providers and facilities. Don't come in as Rhino Park Catholic Lady Pohamba. You will suffer the same consequences if this thing hits us. Get together and get something working together, really honest, that it doesn't matter whether this patient was at Lady Pohamba or Catholic or Central or somewhere, but you as health professional group in Namibia responding appropriately and in a united form against the virus. This is what is going to help us, not this individual, each one pulling a thing in the corner here. It's not going to help us. It will help the affluent here in town who will have access to the best facility, but an ordinary person there will still die because of this segregated approach to the pandemic. That's the warning I want to give to my colleagues there. Over to you.
Thank you so much. To Dr. Pino and to Hannelie, thank you so much for joining us this morning. And I think indeed, like Dr. Afiku said, joining hands, and I think health professionals have been doing that, and facilities have been doing that. They've been joining hands, and we'd like to see more of that happen. I also think in a few weeks, when I ask about Omicron again, we'll have completely different answers in terms of the characteristics of this virus and what the actual threats are, and how we're going to be tackling that. But in a nutshell, thank you so much to you, Hannelie, and all the staff of Lady Pohamba Private Hospital that have done an immense job in saving lives and just giving their best to the general public and to their patients. And the same to Robert Mugabe Clinic. Robert Mugabe Clinic, I think, has a new respect amongst Namibians for the work that they're doing and the lives that they've saved and the treatment that they've been giving to people that have contracted COVID-19. So thank you so much for your time this morning, and extend all our warm wishes, and thank you as well to your staff at your respective facilities.
The Ask the Experts platform is a monthly segment that offers an opportunity for Namibian journalists to engage noted experts in one-on-one discussions on the COVID-19 pandemic. Journalists get to pose questions to experts in various sectors to ensure that they are equipped with the necessary information to better inform their readers, listeners, and viewers. COVID-19 is our common enemy. Together, we can defeat it. Proudly brought to you by the Namibia Media Trust and the DW Academy.